Researchers at UW Health announced a groundbreaking method identifying middle-aged people who are at risk of cognitive decline in 10 years.
Nearly 3,400 people with the potential of developing dementia, Alzheimer's disease, and other cognitive issues took part in the study. The goal of the project is to identify people who are at risk in advance, catching the issue as early as possible. Doctors are now implementing targeted interventions to delay or mitigate cognitive decline.
So the diseases often start decades before we see any clinical symptoms, and this may often start in midlife already. And so the field is still trying to find good predictors, good markers for who is at risk of developing dementia or neurodegenerative diseases later in life.